Today, I'd like to talk about scaling, a treatment that many people know about, but don't regularly practice. Because not practicing scaling regularly can lead to bigger problems over time, I think it would be good to take this opportunity to understand why scaling is necessary. Scaling, simply put, is a treatment that removes plaque and tartar that build up between the teeth and gums. Tartar may look like just a hard stain on the surface, but it is actually a lump full of bacteria. If you leave it untreated, it causes inflammation in the gums and eventually damages the bone that supports the gums. Teeth have their roots placed inside the jawbone, and the gums cover them on top. Because of this structure, a narrow and deep space is formed between the teeth and the gums. Even if you brush your teeth thoroughly, the toothbrush cannot reach this area well, so plaque and tartar tend to accumulate there. If this is left untreated for a long time, the substances that have built up between the teeth and gums cause inflammation, and as the inflammation becomes more severe, it melts the jawbone. This is commonly referred to as gum disease or pyorrhea. When it progresses, the gums swell, bleed, and the teeth start to shake, eventually leading to a situation where the tooth has to be extracted. Especially among middle-aged and older patients, many say, "It doesn't hurt, but suddenly my tooth is loose." This is exactly the result of periodontitis that has been left untreated for a long time. Regular scaling is important. Even getting it just once a year can help prevent gum inflammation, and there's also the advantage that cavities or other problems can be found early during the scaling process. Early treatment costs less, causes less pain, and takes less time. But that doesn't mean getting it once a year is enough for everyone. People who have poor gum condition, smoke, have diseases such as diabetes, or have difficulty managing oral hygiene, should receive scaling every 6 months or even every 3 months. At the dental clinic, we guide each patient with the appropriate interval based on their individual condition, so we recommend that you consult and determine the schedule that suits you best. We often get the question, do I really need scaling, even if I have no symptoms? And the answer is yes, you should get it even if you don't have symptoms. Gum disease often shows no symptoms in the early stages, and then suddenly appears all at once. Regular scaling is literally the easiest way to achieve all three effects: prevention, early diagnosis, and simple treatment. Scaling itself is a simple procedure that removes tartar and plaque, but it is also an essential treatment for maintaining the health of your teeth and gums. Just receiving it once a year on a regular basis can help prevent various oral diseases such as periodontitis and cavities. Even if you don't have any particular pain or uncomfortable symptoms, oral problems like gum disease or cavities often have almost no noticeable symptoms in the early stages, so they can gradually progress without you even realizing it. That is why, even just as a preventive measure, we recommend visiting the dentist regularly to receive oral checkups, including scaling before problems occur.